Hello friends, it's pleasure to have you back on the channel of Clinical Care Insights. So we already finished the first chapter in the pathology, in which we discussed already about what actually pathology is. Basically, it is a subfield of medical science where we are studying the diseases. Okay, study of disease is called as the pathology. We also seen some of the branches of the pathology. Okay, then we moved forward and we discussed about the different methods in the pathology. Okay, and we also discuss about the historical aspect of pathology. Now today's we are going to start a new chapter in the pathology. Okay, and that is called as the cellular adaptation and cell injury. Means whenever cells undergoes, okay, or cells have any abnormal stress, okay, then what cell will show, okay, what happened to the cell, that all thing is covered under the chapter called as the cellular adaptation and cell injury. Got it? So here is the lecture outline, what we are going to discuss in this lecture. First we will define the term, what is mean by the cellular adaptation and the cell injury. Then we will also discuss about the overview of cell structure. Now you may thinking that why I am revising you again the cytology, the study about the cell. Just because first you have to at least overview all the cell, you can say organelles, cell parts. Okay, if you understand all those cell organelles, cell parts, then you can easily understand the underlying pathology. Fine. Then we will discuss about the cell injury and adaptation in detail. Okay, now so before moving in detail in today's lecture, I'm just going to briefly introduce you the two things which you have to keep in your mind, that for sake of study the pathology, okay, for a study of the pathology, generally we are dividing the pathology into the two subfields. Okay, into the two subfields. The first field is called as the general pathology. Okay, the first is called as the general pathology. Okay, and another one is called as the systematic pathology or systemic pathology. Systemic pathology. Now, under the general pathology, basically we are going to discuss about the cell, okay, and the cell injury. Okay, this is comes under the general pathology. Means if cell undergo any, you can say, stress. Suppose this is your cell, okay, and you know that cell is having the nucleus and many other cell organelles, internal cell organelles. Okay, and if there is any, you can say, lethal injury, okay, lethal to moderate, okay, injury to the cell, okay, then cell will show certain changes. Cell will show certain changes. So all those changes is studied under the branch of general pathology. Clear? Fine. Now in the systemic pathology, we are going to discuss about the pathology of different system, like pathology of GIT, okay, pathology of cardiovascular system, pathology of, you can say, the neural system. Got it? So it is basically a system-wise studying of the pathology. Got it? Whereas in the case of general pathology, basically we are only going to discuss about the cell injury, cell adaptation. Got it? So here we are discussing the general pathology. Got it? Now just quickly understand what is mean by the cell adaptation and cell injury. So for that I will show you via a diagram. Suppose this is a cell, okay, one eukaryotic cell, and it got injury, okay. The injury may be, you can say, the normal injury, okay, normal injury. It can be mild injury, or it can be severe lethal injury. Okay, it can be the lethal injury. Now once cell get this kind of injury, okay, cell will undergo certain changes. Cell will undergo certain changes. So all those changes is called as the cellular adaptation. Okay, all those changes is called as the cellular adaptation. Cellular adaptation. Okay, it can be cell can die. Okay, cell can die, fine. Okay, or cell can adapt. Okay, if the injury is, you can say, the milder one, then cell can adjust themselves. Okay, cell can adjust themselves according to the stimulus of injury. Okay, if cell got injury, suppose if cell got the mild injury, okay, then it cell can enhance their function. Okay, cell become the over functional. Cell become the over functional. Okay, we are talking about the cellular adaptation. Or the another possibility is cell start degenerating slowly. Okay, cell start degenerating slowly. That is called as the degeneration. Degeneration means whenever cell get injury, okay, it undergoes certain changes, and all those changes is called as the cellular adaptation. Cellular adaptation. Cell die themselves, or cell become over functional, or cell start slowly degenerating. Cell start slowly degenerating. Here there is a degeneration. Here this death can be the two type. Death can be the two type. The first type is called as apoptosis. The first type is called as the apoptosis. Another type is called as the necrosis. Another type is called as the necrosis. So this is the two means via which cell can die. Okay, these are the two means by which cell can die. Cellular death can happen by the two means. The one is called as the apoptosis, another one is called. So for understanding what is apoptosis and necrosis, we have to take the example, one example. See, when cell get injury, okay, cell get injury, it can be the normal, milder or lethal injury. Fine, no problem. So when there is a normal injury to the cell, okay, cell may undergo the apoptosis or it may undergo the necrosis, depending upon the severity of injury is the first criteria. Both are the, you can say, the cell death process. Both are the cell death process. First of all, these things you should clear in your mind, that this both apoptosis process and necrosis is a phenomenon of death, okay, for the cell. Okay, so there's a two option for the cell in our body. For death phenomenon, there's a two option. The one is called as the apoptosis, another one is called as the necrosis. But these two are different. These two are different. This apoptosis is cell's own phenomenon. Apoptosis is cell's own phenomenon, means whenever any cell become, you can say, abnormal, okay, or if any cell, you can say, become over functional, then there are others, you can say, the cells which direct those abnormal cells and make them die. This phenomenon is called as the apoptosis. This phenomenon is called as the apoptosis. Basically, it is a suicide of the cell. It is a suicide of the cell. Now, for example, if you can take the beautiful example from the embryology. From the embryology. When we are in the form of fetus, when we are in the form of embryo, basically, you know that sexual reproduction necessitates the fusion of sperm and the egg, and there will be a formation of zygote. Zygote undergoes subsequential division, a cleavage, and form, you can say, embryo. Embryo is basically a undifferentiated cell mass. It is basically undifferentiated cell mass, and from the embryo there is a organogenesis. So during the formation of organ, means during the organogenesis time period, we need elimination of certain cell. Fine. So for that elimination, this apoptosis, okay, is done. Okay, that elimination process is done by the apoptosis. apoptosis. Okay, it's a basically cell on suicidal process. Got it? Now coming to the necrosis, when cell undergo the lethal injury, lethal or severe injury, okay, then cell will show this phenomenon called as the necrosis, so it is a basically a pathological cell death. It is a pathological cell death, whereas apoptosis is always natural cell death. Now you have the clear distinction between the apoptosis and the necrosis. We will discuss in detail. Another difference is that apoptosis will not produce the inflammation, whereas the necrosis absolutely, you can say, shows the inflammation. Another thing is that apoptosis occurs generally in a one cell or very small cluster of the cell, whereas necrosis always occurs in a large, you can say, in a large group of cell or a tissue. Got it? Now coming to the overfunctionality of a cell. Okay, the first thing is, by getting the injury, cell can die, and die by the two means. One is apoptosis and necrosis. Or by getting the, you can say, the milder or the normal injury, cell can adjust their, you can say, processes. Cell can adjust themselves, okay, according to the injury stimuli, fine. That is called as the overfunctionality. Either cell can become overfunctional, okay, or either they become the underfunctional. So both things can happen. Or either cell start the slow, you can say, changes, okay, slow changes which cannot be reversed back, and that is called as the degeneration. Got it? No problem. So this is the cellular adaptation. Now coming to the cell injury. Cell injury is a injury to the cell. Simple, and it can be the normal, milder one, or lethal injury. No problem. Now let's move forward and just take a glance of the eukaryotic cell, eukaryotic structure, because we have to just quickly revise those structure in order to understand these apoptosis or necrosis process in detail. Fine.